My name is Aiwane A. I'm an osteopathic physician here at Jefferson, dealing primarily with acquired brain injury patients. I'm one of the people that wanted to be a doctor all her life. My father died when I was very young, and so the body and how that can impact someone who is relatively healthy and then can pass away really quickly always was something that interested me. I went to medical school at Ohio University. I did my residency in Kansas University and completed my brain injury fellowship at University of Texas at Southwestern. My aha moment was probably in residency. It was around the time when I was trying to consider which 3 specialties that I wanted to go to and specialize in. And again, I had a patient. He was a brain injury patient. He was unable to articulate what it is that was bothering him, his ailments. Whenever the attending on service was able to discuss with him, for some reason or another, he remembered me. I'm just a little medical student, but he always remembered me, and so he was my patient. He was my first brain injury patient. And at the end of his stay, he was able to remember at least 50% of what it is that we discussed, whereas he wasn't able to do that with anyone else. So I felt very honored and very privileged to be part of his care, and that's when I knew I wanted to do this. I've been here at Jefferson since 2019. After completing my brain injury fellowship, I knew I wanted to come back to the Southeastern region. And Jefferson is a facility that I've always been interested in, I've always wanted to be part of. So when an opportunity presented itself, I knew I needed to be part of the culture. My responsibilities are primarily with patients with acquired brain injury. This can be both traumatic and non-traumatic, primarily dealing with adults. After they have done some rehab stay, whether that's here in Shepherd or elsewhere, and they're needing continuity of care and long-term care, that's where I come in to kind of assist in their everyday needs, whether that is physical, cognitive, therapies, medications, so on and so forth. I see myself kind of as an educator, but also a cheerleader. I want to make sure that they know that this catastrophic event, yes, it has altered your life. However, it doesn't have to be the end all be all. And so that's kind of my mentality and philosophy when I come into medicine.